So we are here now. Let's take a look at the posterior capsule pattern. Okay, so you've decided that the most painful thing you're touching is on the back side of that joint line. It's usually going to be just below the caps. You're going to be able to palpate the bone, the acromial bone, and your finger will fall off that edge going down or south, and you're going to feel a tenderness. Most of the time, this is the infraspinatus or the teres minor tendons, okay? They'll be tender to touch, and you might feel some pain when they're being stretched across the front of the body. But again, pain guided. We're going to put the arm in the position that hurts the most. That's telling us where those cells and where that inflammatory problem is at its greatest. And we're going to, assuage it a little bit. We're going to put the arm in that position. In this case here, it's not that damaged, and so it's relaxed and comfortable. Oftentimes you guys will see if it hurts, the arm might be hanging up here. And I would call a bent elbow pattern that I see quite often is when the humeral bone doesn't want to drop across the front of the body. It'll hang up, it'll stop because there's pain or dysfunction in the back side of that joint line, and there'll be a bend, and nice to relax, just let it fall. And there'll be a bend at the elbow. As that shoulder injury dissipates from these therapies, you're going to see it falling across more and more and more, and the elbow will be straight. So a nice, healthy, relaxed shoulder, it's going to look more like this, where the arms are crossed and there's no bend at the elbow. Take a look at those patterns. Treatment on this. I come to the back. I use some massage lotion on here or my arm, and I'm starting just below that cap, that acromial bone, and I'm stripping downward. So I'm stripping down towards the hip from just below the acromion onto those two tendons. I can rub them in this direction along the plane of the tendon, or I can rub it perpendicular to the plane of that tendon, rubbing downward. And again, we're going to do this for about 5 to 10 minutes, working on that posterior capsule in a stretch position. And then like we did for the front capsule, I can bring the arm back up, give it a break, do some nice shoulder mobilization. The circumduction one is really nice. This is done for about 1 minute to 5 minutes, just to keep the shoulder from getting too aggravated and too much work on it. So each session for the posterior capsule problem, you're looking at 5 to 15 minutes of mobilization, posterior capsule work, tendon work, and then closing it out with some contract relax like we did with that thumb up the back position. I want you to lift that arm straight up into, and relax. And again, on this one here, I'm going to let Christine win, but I do want to put some resistance. And the beauty of this is also going to guide these cells towards repair as well. We'll talk about that a little bit more. Go ahead, lift it up. And relax. And one more time. And relax.